What are the unique sounds of esophageal speech? Imagine trying to speak without your vocal cords. It might sound unusual, but people who have had a laryngectomy find ways to communicate using their esophagus. Esophageal speech is a special method they use to produce voice. Instead of vocal cords vibrating, it relies on the vibration of the upper part of the esophagus and the lower part of the throat. This creates sounds that are quite different from normal speech. One of the most noticeable features is the low pitch. Esophageal speech usually sounds deeper than normal voice, often between 50 and 100 Hz. This is because the vibrating part is larger than the vocal cords, which are removed during a laryngectomy. The voice often feels rough or breathy, like a deep belch or a nasal tone, even though the nose isn't involved. This roughness comes from the irregular vibration of the esophagus. It's less steady than vocal cord vibration, so the sound can be noisy or uneven. The volume of esophageal speech is generally quieter. Speakers need to put in more effort to produce a voice that can be heard clearly. Because of this, they might only say about 5 words on a single breath. The speech rate tends to be slower too, with about 120 words per minute, because controlling the airflow is more challenging. The sounds are produced with less force, so the voice often sounds strained or strained. Even though the voice source is different, the resonance or the way sound vibrates through the mouth and throat remains similar to normal speech. This means vowels and articulation are still understandable if the speaker enunciates clearly. The formant patterns, which are the resonant frequencies of the vocal tract, stay quite similar. That helps listeners understand the words despite the different voice quality. Learning to speak with esophageal speech takes practice. It involves training to control how air is injected into and released from the esophagus. Speech therapists work with patients to improve pitch, loudness, and clarity. Because the voice is quieter and more effortful, people might need to use environmental adjustments or amplification devices to communicate better. In summary, the sounds of esophageal speech are characterized by a deep, rough, and quieter voice. It has a slower speech rate but retains the ability to produce recognizable vowel sounds and words. These unique features come from the vibration of the upper esophagus instead of the vocal cords, making it a special way for people to keep talking after a laryngectomy.